You know,
as a conversation.
Yeah, just like a lot of people ask me this, and I was wondering, what is the difference between this and this?
Yeah.
Let's see. I'll just use you as an example. I'll use the old one. Not even know if I use the x-rays, but...
Okay.
Alright. So, you usually start, right?
Is it good?
Mm-hmm.
Recording?
Yeah.
Okay, so usually when I deal with a lot of clients, when they get injured or anything from minor to major, they always ask me, or they always tell me, I think I slipped a disc, I think I slipped a disc, but I don't think I've ever come across someone that's actually slipped a disc. So, what is a slip disc truly? And like, how does it usually happen? And so on and so forth.
Alright, so this idea that discs slip, I don't even know where that came from, but people use that all the time.
Yeah.
Maybe it's in movies or something like
It
that.
makes it sound like your spine is literally getting severed and then a part of it is like coming out or something, right?
Or like these parts kind of slide around, but they don't really.
Yeah.
So the disc, if you don't understand what a disc is, it's kind of like the brake pad on your brakes.
Yeah.
And it's in between the bones of your spine and keeps the bones away from each other, and it acts as a cushion. It's soft tissue.
So it's like a
fluid-filled sac, basically.
Yeah, okay.
So the healthier and thicker that they are, the better off your spine's going to be, because it's going to open up those little nerve holes, the foramen where the nerves come out of the spinal cord.
Okay.
So the nerves are your lifeline.
Yeah.
It runs every single cell in your body. It sends messages from your brain to every part of your body. So discs typically bulge as
Yeah.
we get older.
Yeah.
Gravity is compressing us.
Yeah.
So if gravity is compressing on a healthy spine, it'll wear down, but very, very slowly. Now, if someone looks like this,
Yeah.
it's going to wear down fast. Just like if your tires are out of alignment in your car,
Yeah.
it's going to wear down your tires unevenly, right? And so we want to slow that process down, keeping these discs really healthy by having the proper curves from the side so that gravity doesn't do so much damage.
Yeah.
And then straight from the back, so it's not putting more pressure on one side than the other, causing it to bulge.
Oh,
So
okay.
now bulging discs, they say if you do an MRI, which looks at soft tissue, of
Yeah.
every person over 40, most of them are going to have bulging discs.
Yeah.
Bulging disc is a general bulge of the soft tissue between the two bones. So that's a
Okay.
bulging disc, right?
Okay.
Now, a herniated disc is a whole different thing.
Yeah.
That is a focal spot that is torn. The fluid inside is bulging out, so it can be very confusing because it's bulging out in one
I think
little
that's what
area.
people think when they think of
Slip
slip disc.
disc.
I think it's actually just a herniated disc.
Herniated disc,
Okay.
right. And you probably don't see very many of those.
No,
Typically, when somebody herniates a disc, the disc isn't the problem, the nerve is the problem still.
Okay.
Because it traps, it traps the nerve between that herniated disc and the back of the bone here.
Okay.
So if it gets trapped, it is damaging to the nerve,
Uh-huh.
and you usually get pain somewhere else in that nerve pathway. So if it's down in the low back, which is very common,
Yeah.
so let's say this person right here, you can see this is not straight, it is tilted.
Yeah.
And which side do you think the disc is going to be compromised?
Left side?
Right there. So if you're putting more pressure on this side and it's wedged on that side,
Yeah, it's
it's
just
got
gonna-
nowhere to go but bulging.
Yeah.
Right?
True.
And this will bulge too, but you're going to possibly trap the nerve here. Now, herniated discs, we see a lot of people with herniated discs actually.
Really?
And yeah, they do surgery on these people, but it doesn't come out very well. They usually have to do another surgery or fusion. There's all kinds of things I want to get into right now.
Yeah.
But what we want to do, we use this table, it's a traction table. We open up that disc space.
Yeah.
Helping the disc get sucked back in,
Yeah.
and then we align the spine and help the body heal itself by taking the pressure off of it.
Yeah.
And it takes a long time,
Yeah.
but once you cut into there,
Yeah.
it's never the same again.
Oh yeah, it's
right?
better.
You're cutting
Spinal
through
fusion is insanity, right?
or even just cutting the little, if you just laser that down,
Yeah.
sometimes people do okay, a lot of times it comes right back because they haven't fixed the reason it got that way.
Yeah.
So then it just happens again. So there's herniated discs,
Yeah.
there's bulging discs.
Which is kind of comes inherently by living on Earth, right? With for
it'll happen,
the average person that doesn't really take care of their spine,
it happens
like
a lot faster.
over a long period of time, it's kind of inevitable, right?
Right. Gravity's going to cause some pressure on there,
Yeah.
and it's going to wear down. But we want to get as healthy as possible.
Yeah.
So drinking water, good diet,
Yeah.
good exercise programs, making sure everything's symmetrical, and definitely keeping your spine in alignment is going to keep it healthy and moving properly. Aberrant motion or lack of motion is going to start slowing it down.
Yeah.
All the flow down, and then
Yeah.
causing death of the cells.
Yeah.
So you want to get that back into normal balance.
Yeah, so everything's pretty much all linked together. What'd you say? Like the density of the spine.
The thickness of the disc.
No, I'm talking about just lifting weights, just bone density,
Bone
and
density.
having nice thick discs,
Right.
and then combine that with having your spine aligned so that the disc bulging is minimalized, and that over time is going to give you the longest longevity before you die.
And the healing process, because these nerves are what heals everything as
Yeah.
well. So when you get a herniated disc,
Yeah.
a lot of times people get numbness and tingling, pain, weakness.
Oh,
I've
man.
seen muscles shrinking,
Just
all kinds of
atrophy
things.
just because they can't use it.
Well, partly because they're not using it, but the nerve flow itself will cause the muscle to start shrinking.
Yeah.
Because you're not getting the nerve flow, sending the messages there. So we wanted everything to be as healthy as we
Yeah.
can, but sometimes they herniate from I've seen people who have fallen off a roof or
Yeah.
fallen, 2 stories or
Yeah.
horrible car accidents.
Yeah.
So keeping it as healthy as possible, but slip discs, I want people to stop using that term. Slip disc
That
doesn't
term
really
is,
happen.
yeah, that term sounds like, it sounds like
Slipping out.
literally this thing is like coming out like a pepperoni slice. So there's bulge disc, which is this is just over time, it's going to compress, and then there's herniated disc, right?
Just a focal spot.
Focal spot where it's
Typically trapping a nerve.
where it's a nerve getting trapped.
Right.
And so the typical, I'd say, really bad weightlifting injuries where people say, oh, I can't lift anymore, those are probably herniated discs that go unchecked. But
If they're getting leg pain,
yeah,
and all the signs, there's a lot of different orthopedic signs that will show that it's more likely a disc problem.
yeah,
But you can tear any of the soft tissue around here
Yeah.
and lock up the joints,
yeah,
and you're not going to be able to lift weights.
yeah,
It's going to be very difficult.
true.
So keep your disc healthy by all the things that make the rest of your body healthy. But remember that discs don't really slip. You might slip and herniate a disc,
Yeah.
but you're not going to slip a disc.
What a misleading term. I
It's
think
very
it scares
confusing.
people more than, yeah. So basically everything is all intertwined within each other. Disc bulge, herniated disc, everything it comes down to good exercise program, keeping those nice discs like really thick, keeping your spine aligned so none of that nice soft suspension jelly slips out, and then just don't fall off a roof, I guess.
All right, thanks.
All right, thanks guys. Check you guys next time.